ஹாய் ஹலோ ஃப்ரெண்ட்ஸ். இன்றைக்கி இந்த வீடியோவில் நம்ம என்ன பார்க்க போகிறோம்னா ஜிப்மர் நர்சிங் எக்ஸாம் ப்ரிப்ரேஷன் தான் பார்க்க போகிறோம். ஜிப்மர் எக்ஸாம் டேட் நெருங்கிருச்சு, September 14 எக்ஸாமு. ஸோ ஃப்ரீக்வெண்ட்லி ஆஸ்க்டு கொஷின்ஸும் இம்பார்ட்டன்ட் கொஷின் ஆன்சர்ஸ் தான் இந்த வீடியோவில் பார்க்க போகிறோம். ஃபர்ஸ்ட் கொஷின் வந்து, இன் அ பேஷண்ட் ஆஃப் ஸ்ட்ரோக் the dexamethasone is administered to option A increased intracranial pressure, option B reduced intracranial pressure, C increased renal blood flow, D decreased renal blood flow. And the answer is B reduced intracranial pressure. Cervical changes in pregnancy are all except A increased collagen, B increased hyaluronic acid, C increased glands, D increased vascularity. And the answer is B increased hyaluronic acid. The most common cause of rectovaginal fistula is option A obstetrical, B irradiation of the pelvis, C carcinoma, D Crohn disease, E endometriosis. The answer is A obstetrical. The most effective treatment of pruritus vulvae associated with atrophic vulvitis is A antihistamines, B hydrocortisone, C alcoholic injections, D tranquilizers, E topical estrogen therapy. Answer is E topical estrogen therapy. A client at 15 weeks gestation may be scheduled for the following tests except A amniocentesis, B serum alpha fetoprotein, D Doppler ultrasound, D chorionic villi sample. Answer is D chorionic villi sample. What of the following is seen in partial mole? Option A triploidy, B polyploidy, C haploidy, D diploidy. Answer is A triploidy. Frog eye appearance is seen in A anencephaly, B accardia, C Down syndrome, D Pasteur syndrome. Answer is A anencephaly. As a client progresses through pregnancy, she develops constipation. What is the primary cause of this problem during pregnancy? A decreased appetite, B inadequate fluid intake, C prolonged gastric emptying, D reduced intestinal motility. Answer is D reduced intestinal motility. The nurse Chakravarti Nair is planning care for a 15-year-old client in the prenatal clinic. Adolescents are prone to which complications during pregnancy? A iron deficiency anemia, B varicositis, C nausea and vomiting, D gestational diabetes. Answer is A iron deficiency anemia. Mean age for menopause is A 40 years, B 51 years, C 45 years, D 48 years, E 39 years. Answer is B 51 years. The most common cause of vesicovaginal fistula in underdeveloped countries would be A obstetrical injuries, B carcinoma, C operative injury, D pelvic irradiation, E hemorrhoidectomy. Answer is obstetrical injury. Menarche usually occurs at age of A 8 and 10 years, B 14 and 16 years, C 18 and above, D 11 and 13 years, E 17 and 18 years. Answer is D 11 and 13 years. The maximum number of oogonia are formed at what the age of female life? A 1 month intrauterine, B. 5-month intrauterine. C. At birth. D. At puberty. E. At 21 years of age. Answer is B. 5-month intrauterine. Which of the following is used to take cervical smear? A. Colposcope. B. Vaginoscope. C. Iris spatula. D. Laparoscope. E. Forceps. Answer is iris spatula. Normal duration of menstrual cycle is A. 1 to 3 days. B. 1 to 4 days. C. 2 to 7 days. D. 7 to 10 days. E. 1 to 2 days. Answer is C. 2 to 7 days. Women complaining of milky whitish discharge with fishy odor, no issue of itching. Most likely diagnosis is A. Bacterial vaginosis. B. Trichomoniasis. C. Candidiasis. D. Malignancy. E. Urinary tract infection. The answer is A. Bacterial vaginosis. Calmest presentation of choriocarcinoma. A. Vaginal bleeding. B. Abdominal pain. C. Breathlessness. D. Perforation of uterus. And the answer is A. Vaginal bleeding. Gonadotropin releasing hormone stimulates the release of A. ACTH. B. Growth hormone. C. Luteinizing hormone. D. Thyroid stimulating hormone. D. E. Opiate peptides. And the answer is luteinizing hormone. Option C. Serum prolactin level are highest in which of the following condition? Option A. Menopause. B. Ovulation. C. Parturition. D. Running. Answer is C. Parturition. Main uterine support is A. Uterosacral ligament. B. Round ligament. C. Transverse cervical ligament. D. Ovarian ligament. E. Broad ligament. Answer is C. Transverse cervical ligament. And thank you.